Hey guys, it's Mike here from Medic Materials Podcast, and what do EMS providers like more than coffee and liquor? Well, that's a fucking t-shirt. So go over to medicmaterials.com/merch and pick up your Donut IV t-shirt right now. It is my favorite t-shirt. I wear it all the time to show my support and love for the podcast. You guys can too. Pick up yours today, medicmaterials.com/merch.
You're listening to the Medic Materials Podcast, hosted by Mike Turek, Emily Yates, Kelsey Coons, and Gerard Cuomo. Each month, we discuss EMS news, medical science, and review actual EMS calls, bringing many educational opportunities to the listener. Portions of the calls have been altered to protect the privacy and identity of all involved.
Hello and welcome everyone back to the Medic Materials Podcast. We have a very stacked show tonight in that I think it's the fullest panel we've had in quite a while. It's going to take me like 5 minutes to introduce everybody, but that's okay. Gerard, the original OG, how are you, sir?
Oh, I'm doing just fine. How y'all doing?
How's it feel to be back in the bastions of freedom? How's it smell down there?
It smells like seawater.
All right.
But it feels good.
It feels good. There you go.
We had a beautiful sunny day, about 75 degrees. Nice.
Must be
Good.
nice. Must be
Kind of can't
nice.
see it, though.
We have the Maha Witcha with us.
Witcha?
Witcha.
Which
I'll hit myself on that one already.
already?
30 seconds into the show, he's already busted himself.
I know, it's terrible. I was listening to old shows today, and the buzzer, like, I buzzed myself before I even said a word. Because I knew I was going to fuck it up. I was like, yep, nope, I'm just, ding. Miss
I heard
Emily.
Phil buzzed himself today, too.
Oh, giggity.
Oh,
We will get to the Phil Foundation, but Emily, surprise entry for tonight's recording. How are you?
Yes, I wasn't expecting
How are
it.
you?
Oh, just peachy and ducky, and so excited that you're here. Again, we were not expecting you, and I was very surprised and shocked. And I was like, yay, she's gonna be here.
I was like, oh man, it's gonna be close.
It was
Just
close.
I was like, dang.
But we have to come together as a group and a family and love. And Phil Foundation, I put together something spectacular just for you and your accomplishments today. So in honor of the Phil Foundation, I give to you
and I am going to be the new world heavyweight champion. Speaking of champions.
You're fucking champion, bitches!
Hail to the champion, baby!
Oh, we should have got him little creamers.
Oh, yeah.
You gotta put him on his head.
The cream always rises to
Cream
the
always
top.
rises to the top.
So yeah, Phil, congratulations on being whatever champion you decided to be today.
Wow. God damn.
Congratulations on whatever you did today.
Whatever you did today,
I'm
good
sure
for
your
you.
mom's proud of you.
No, she's not. She's not.
Yep,
Wow.
showing the true colors tonight.
Horrible.
Are you getting a poster for this one too, or?
No, I do have.
We should get posters.
No.
Are there pictures?
There's two.
Did you get
All right.
video so we can watch it?
We need pictures. And if there is video, I can get pictures from the video.
There
And we can make a calendar.
We can make a poster. Oh, calendar.
You should
We-
make
we-
a
Calendar, there you
oh.
go.
You should make a poster of
A
me
Phil for every day.
That
The
would
Phil
just-
calendar.
Oh my
Yes.
god, that'd be wild.
Medic materials calendar for Phil.
So because somebody didn't actually, give two shits enough to find out what the fuck it was for. Why don't you tell us what you want an award for?
That's
today?
what I was trying to do. I just suck at hosting. We all know this. Phil, talk.
Oh, talk now.
Do it now. Do the talky thing out your mouth.
I placed first in my 185 weight class, which is the hardest fucking cut I have ever done in my life because I was 227 pounds before for my powerlifting meet today.
Wow, what'd you do?
For you.
205 for bench and 355 for deadlift.
Yep.
Excellent.
I couldn't
You come
do
in
that.
first?
Nope.
And then almost fucking died on my last deadlift, but we're just gonna forget about that.
Did you win?
I did.
Yes.
Oh, okay. See, that's the information that people need.
He got a medal.
He got him.
You got a
man.
medal?
Dude, it's in my car if you want to see it.
Well, when's the drive home?
Tomorrow.
9 o'clock
Tomorrow
Oh,
morning.
we're on the wrong goddamn day, aren't we?
Yeah,
God damn it.
yeah, we are on the wrong goddamn
I was
day.
gonna say, well, dude, you're at work. That shit should be around your neck right now.
That's right. You need to take every call. Look what
That's
I
right.
did today.
I mean, I'll
Oh,
go
with the
and
belt.
put it on if you want. I have the belt in my car too.
Oh, throw 'em up.
Oh,
Yes, please.
dude,
Yes, please.
Too?
go.
Absolutely.
Come
Iris,
on.
that should have been.
Oh,
That already should have been on there.
That should have
I know.
been.
He
Right,
was
as soon as
not
the video
prepared.
comes in, boom, there he is. Fucking production quality, man. We gotta get the game up.
Yeah, well,
He should have had his shit ready to go.
We should
That's
have.
good.
I didn't even think about it. You know, it is what it is. But as always,
Nope.
we are live here tonight. I was away last night, so we couldn't do it on the Friday stream. So here we are on Saturday. But what was that?
How'd the Mets do?
They lost, of course, because I was there.
Shocker.
And, I paid money to see them, so the fucking assholes lost.
So on that post, about me being home, she's like, "Boo!" I went, "Oh, you're at the Mets game too."
Yeah, it was slightly. The boys had fun. It really sucked because like the there was like an hour and a half rain delay, so the game that should have started at like 7:10 didn't start until almost 8:50. So like that kind of sucked. So the game didn't actually end until almost midnight, because then it was a drawn out game, and yeah, it was. But
in the city, or did you make it home?
No, I drove it. So I found out it's a 4-hour drive to City Field. It's now a 4. Yeah, it sucks. It sucks. But it is what it is. So we have to welcome our peeps in the stream. Let's see, WW2 Girls here with us, Stacy's here with us, and the Mac is back in the stream.
Oh,
so we're throwing out a Ric Flair on that one. And maybe I'll give him a yeah as well. let's get down into the rig check, and then we'll start this this call that I have for you guys today.
Oh yeah.
So, guys, I want to help. I want to remind you guys that you guys can help support the stream and the growth of the podcast by sharing it across all of your social media networks and all of your social media accounts. Invite your friends and your coworkers to join the Facebook page or the group. And if that isn't your cup of tea, there's a link in the description down below that you can tip us directly. That always helps and is always much appreciated. Our brand new I'm terrible at speaking tonight, apparently.
Ow.
Yeah, fuck it all.
Just sit on the buzzer, dude.
Just sit on it.
At least you get some enjoyment out of it.
I know, right? Our brand new medic potato. Damn it, I did it again.
Wow.
Motherfucker don't even know the name of his own company.
Material.
This is what happened, Gerard, when you don't allow me to drink every night anymore, all right? This is your fault. I unlearned English, all right? But our merch page is up right now for you guys to check out. Visit medicmaterials.com/merch. There's stickers, there's water bottles, there's awesome new t-shirts, and most importantly, there's the fucking cronut. So,
oh, hell yeah.
Yeah, go grab yourself a goddamn fucking cronut. And you
don't
better
have
do
hoodies
that
yet.
because I might be doing something very interesting in maybe a sweepstakes or, you know, something with not what you were thinking, you dirty bastard.
I was like, well, it does have a hole in it.
It does have a hole in it, but those, I want to thank Gerard. I have to shout out your fiance Tammy. She's the one that makes us the exclusive cronuts. So support her, support us. Buy yourself a fucking cronut.
Please.
All right.
Make her happy.
Yeah. Lastly,
Just spare me the rod.
Lastly, I gotta give our shout outs this month to our listeners in Wyoming and France, and our newest Patreons, Chris and Susan. Thank you guys for all the continued, support and following us on this absolutely incredible ride. We are nearing 20,000 downloads for the podcast. We've been here for 4 seasons, and no matter if like you're an OGer like Gerard and I, or you're just joining us, you guys are equally amazing, and we love each and every single one of you. So,
20,000 people just heard you eat that.
Yeah, well, you know, it is what it is.
Twice. On
Yeah,
the same word.
Of my own company, right? And
That he made.
yeah, I'll dig myself twice. Why not?
Do that again.
Do it again. So
I'll give you 15 minutes to cut that out.
So let's dive into this call review here, guys. Your guys' system. This call is taking place in a mostly rural district. It's covered by a town BLS ambulance service who runs 1 rig daily that's staffed with 2 EMT basics. ALS is provided by a neighboring town who offers a paramedic staffed ambulance under a mutual aid agreement.
That always works out good.
It always works out. Like, yeah, we don't need to do
Transport what?
Flawless. It's how it should always be.
Absolutely, right? The hospitals in the area, there are multiple hospitals within this immediate area. There's a 4-bed critical access center, 15 minutes from the scene.
Yeah, we don't.
Definitely got to go there, right?
No.
There's a local community hospital about 40 minutes away from this scene. And there's a larger community hospital that has cardiac capabilities like PCI about an hour and 15 from this scene. All right. So you guys are going to be
shit, and meh.
Yes, exactly.
Okay.
Shit, and meh.
Meh.
Yeah.
Okay.
So you guys are going to be dispatched a priority 1 or a Delta priority to a local residence for a 48-year-old female with chest, back, and abdominal pain. The BLS agency is dispatched as well as the neighboring ALS agency. So I always throw out a question here in the beginning. With complaints such as chest, back, abdo pain from a female, Gerard, you said it sounds automatically like an MI cardiac. Is that something that you guys automatically go to, or is there like something else that you're going to go to and then kind of figure your way out from there?
With this one, that's where I'm starting.
Yeah, I always rule out cardiac first and then go down the list from there.
Unless I feel
Yeah, true for the worst, hope for the best.
Yeah, exactly.
I think, especially with all of those in a female, you're like, yep, screams cardiac. Why don't we rule out cardiac first? All right, I 100% agree. So
Unless she was hit by a truck before we got there, it says, "Oh my,"
Right, she's got like multiple gunshot wounds. It's like, let's get the 12 lead going.
Right, exactly. So
give me a blood sugar.
I think it causes the power of flight. So
the BLS.
Whoa. What the fuck just happened to Phil?
Phil turned into a CPR dummy with really creepy eyes. That's what he did.
It's fabulous internet service.
Yeah, I'm running off of my hotspot because the Wi-Fi service here is a little iffy.
I also love how on the stream, because his picture changed, it also changed Phil to the Maha and the Maha to Phil.
I'm now Phil.
And now they're back.
Here we go.
I'm back to Maha.
Now you do it and see who you turn into.
Yeah, right?
Next magic trick.
So
I gotta give the belt to you, Butch. I'm sorry.
Oh no!
Oh, here I go again.
Jesus fucking
What
Christ!
the hell is going on?
What?
Stop it!
It's like the cup and ball game. It's like, where are we now?
Sir, what's gonna happen if I get booted off the stream? Is the whole thing gonna explode?
It's gonna all explode. Everything's gonna go everywhere.
Dude,
it's
quit putting that
totally
creepy
fine.
fuck on there. Change your picture.
So the BLS crew arrives on the scene a short while after dispatch, and they grab their first in bag and they walk towards the house. They're met by a woman who's speaking very broken, hard to understand English. This woman tells the crew to follow her into the house and then guides them to a back bedroom to meet their actual patient. The EMTs enter the bedroom and they find an adult female sitting in bed with her legs out in front of her. They introduce themselves and begin talking with her to identify like chief complaint. Why are they actually here?
Straight out in front of her?
Yes.
Or
nope, straight out in front of her.
Okay.
Equidistant, laterally.
Yeah, my medical anatomical correct.
The woman tells the crew that she's experiencing sharp stabbing, constant pain to the left side of her abdomen, just under her rib cage. So the upper left, quadrant. This pain started a few days ago and has been intermittent, but has aggressively increased in severity since yesterday evening. So the primary EMT walks up to her to begin their, physical exam. They find that she's conscious, alert, oriented ×4. She's able to answer all questions. Airway is open. It's clear of any fluid or debris. Breathing is slightly tachypnic, but does not appear labored. Lung sounds are taken in the primary, which kudos to them. Clear and equal. All fields bilat. Peripheral pulses are present and strong. She appears pale in color. And
That's my next question.
And she tells the EMS crew that she feels feverish. But when they actually do, hey, let me feel your forehead, let me feel your arm, she feels normal in temperature to the touch of the EMS crew. So does anything kind of like stick out in your mind with this initial like primary presentation? With the chief complaint of this really sharp stabbing, constant left upper quadrant pain.
It's feeling like I'm kind of still going down that same path. It's actually just kind of solidifying it for me, but
yeah, I mean, if she's pale, there has to be a circulatory issue.
Right. That's a perfusion issue.
There's something going on either with the pumps or with the pipes that's not perfusing the skin enough.
The only thing that's throwing me off is that what was the shit? My bad.
What?
I'm drawing a fucking blank. The last thing you said that she was mentioning that kind of just was like mentioned in fantasy.
She felt fever.
She's feeling
Feverish. That's
Yeah.
right. I don't know. Wow, that just.
See, I'm
complete
telling you,
fucking brain fart.
no more Saturdays, right? We screwed.
Wow.
Nope.
Yeah,
done.
fuck Saturday, man.
Fuck Saturday.
Saturday's
We're all fucked.
Well, I did just drive like 600 miles, so
yeah.
that
Yeah.
kind of sucks too. But no, yeah, the feverish thing. I don't know. I might pluck it and file it. But
Has she had any
Sure,
trauma recently that could have caused any problems? that she knows
So
of?
there's no identifiable trauma. There's no any trauma reported to this.
Is she pregnant?
So they end up going there, but she denies everything, as we'll find out in a little bit.
Nurse.
She's what I'm thinking. Wet bandage.
Glucose.
Let's go down our checklist.
Honestly, if she's pale and like diaphoretic, I feel like she probably would feel like she has a fever, which could be like Phil said, a circulatory issue or a perfusion issue.
That's kind of like a false positive for her.
Right.
Kind of, yeah.
Yeah, it's kind of these like, it's definitely an interesting group of symptoms because nothing really sticks out except for that pale color, right? We understand that's a perfusion issue, right? You don't just get pale because nothing's wrong, right?
Right.
So, while this primary EMT is conducting their, initial exam,
She's not emo, right?
What was that?
She's not emo, right?
No, she didn't paint it on.
Okay.
Nope.
Okay.
But
Hey, you never know.
really good thought. I'm okay
You
with
walk in, you see a bunch of Evanescence posters. Hey, maybe
So the primary EMT's partner goes and gathers a full set of vital signs, right? First set of vital signs. Blood pressure via the manual cuff is 160/80.
Okay.
Heart rate of 90, strong and regular via palp.
Okay.
Respiratory rate of 22 and regular.
Me no likey.
SpO2 of 97% on the room air.
I'm starting to reach for the bullshit flag. Hold on.
Temperatures also taken, and returns is 98.9 Fahrenheit via the temporal scanner probe, not the zapper. Go ahead. What is
Plus, I got my hand on the bullshit flag. Let's
Okay.
get that 12 thing.
Okay. We go back to the primary EMT, and they're gonna attempt to try and investigate like this chest and back pain, right? So they're asking like, what the heck has been going on the last couple days? And she tells them that this morning she felt pain across her chest, but that has since gone away. But currently is feeling pain between her shoulder blades. She denied any. Yep. So this morning she was having pain across the chest.
Right. Now it's in the back.
That's gone. Now it's directly between the shoulder blades. Let's see.
I've heard this.
Right, and then they die.
Yes.
You know a thing or two because you've seen a thing or two.
She let's see. She's currently feeling pain between her shoulder blades. She denied any previous medical history. So no respiratory, no cardiac, no nothing.
How old is she again?
48.
48.
Oh, okay.
Let's see, just to confirm that. Yes, 48. Denied any previous medical history, does not take any meds, and has no allergies to food or meds.
Smoker?
Is she an alcoholic?
So I don't have any tobacco or alcohol information for you guys. That couldn't tell you.
All right.
The only other thing I think of is like
Birth control.
So also should have been brought up, birth control. I don't know if it was and just not reported to me, but not brought up.
Just had the plane fly by.
That's the Maha Butchie's road next to his house.
Oh yeah, that's right. I forgot Paul Walker.
It's Fast and Furious Saturday. So
Yeah, I was gonna say the ghost of Paul Walker haunts the street.
Right. So she also tells the EMTs that 3 or so times over the previous couple of days, she had times of nausea and vomiting, but was concerned that some of her vomit appeared bright red. She has not been vomiting today, but is slightly nauseous. Also reported that she has not eaten since yesterday as her pain just increased, but said that when she did eat some like brothy soup yesterday, her pain did slightly subside.
Poop.
So, new information, thoughts,
Poop.
or
Okay.
so she could poop.
I mean, like, has she pooped recently, and what did it look like?
So, poop is loose.
Not that I have a fetish, but I just actually would like to know.
Poop is loose, but
The
normal.
poop is loose.
Poop
All
is
right.
loose. Poop is loose, but it is like normal in color.
Okay, so little diarrhea, but not.
Not like black and tarry diarrhea.
Gotcha. Okay. What about urine output?
Was never asked.
Okay.
So thoughts. There's a lot of information that we're given, and it's kind of scattered all over the fucking place.
I'm still like holding the MI thing here, but I'm starting to kind of play with other things.
What kind of
I
other
really
things?
don't like how I just did that, but okay.
Cardiac. I'm still on cardiac, but splenic rupture possibly.
I was thinking something
Spontaneous splenic rupture?
Aortic tear. I mean,
genius, damn it.
Yeah.
There.
Yeah.
So M,
She just pinched her nose closed and went, splenic
If
rupture.
you say it's a fucking UTI, I swear to God.
some kind of aortic tear or something. Right now.
I can 100% positively report it is not a UTI.
And
I
we
think
don't
you're lying.
know. We don't know alcohol usage, past alcohol usage.
We do not.
I mean, now you're vomiting up blood. So
What meds did she take?
varices or a GI
But
ulcer.
no meds, no history.
No
No meds,
meds, no history. Yep.
Doesn't
And
mean
Did
she
she
doesn't
see
have
a
a history.
doctor?
There you go.
Right.
Yeah.
Well, that's it. Does she actually go to the doctor to find out if she's got uncontrolled hypertension and all this other bullshit?
Last time you went to a doctor, never.
Right. But I also like, the Maha's take in that, like, maybe thinking like esophageal varices, right? Maybe there's something higher in the GI tract that's going on, right?
I mean, she's 48 years old. Who knows? She's not. I mean, history of bulimia or something. She's been yakking her guts off for years, trying to, fit in with the in crowd. All of a sudden, she's developed these varices, and now she's. Hey, it's what we do.
I mean, you don't even need vomiting
Bravo
for
6
years.
is
Like, if
going
she's
dark.
vomiting for weeks, that could cause.
Exactly, right? All that wrenching, that's going to cause damage, right? So,
Yeah.
Retching too, along with the wrenching. Yeah.
right.
Yeah.
That's what I
Yeah,
said.
you got in there with the 10mm socket.
Yeah, if you could dodge a wrench, you can dodge a blow.
That's
That's
absolutely right. So, Em, are you thinking anything specific? Because you have your thinking face on.
I don't know. It's kind of, I want hardcore, I always like tell people, like, patients lie. So take what they have to say, but take it with a grain of salt. I want cold, hard facts. Like, I want to do an assessment. I want vitals. I want an EKG.
There's still more to find out, right? So the
Hold on, Phil's choking.
don't choke, champ.
Don't choke on a douche flute.
You can't.
Hail to the champion, baby!
He can't die.
I mean, I almost did earlier, but we're gonna forget about that part.
He's like Butch from Pulp Fiction. He like smokes a fucking pack of cigarettes, goes out, one hit, lays a dude out, kills him, goes back, got his champ thing on, just smoking away,
just chilling.
It doesn't help that all I smell is ammonia. Like, that is what's getting me.
That's not good, dude. That could be an issue.
Wow.
You gotta have whatever this chick has.
If there might be a specific cause that Phil's leaving out.
Right?
You ever been woken up with smelling salts?
Nah, can't say that I have.
It is the worst thing in the world.
Did you get knocked out today?
I vagaled myself out. So what happened was I went for my last deadlift. I locked my knees
Because he's a fucking idiot.
and I'm 370. I'm straining, and I can
The poop's pouring. Yeah.
Yep.
So I drop it. I fail to lift, and my spotter grabs me by the lifting belt and stands me up,
Dude.
Wow.
I don't feel so.
Dude, flex the fuck out.
Have another energy drink.
So they come over and they're you know how you're supposed to crack the top of the smelling salts and
They just went and shoved it right in your nose, huh?
They opened the entire fucking thing and just stuck it right under my nose.
Wow.
It's lovely.
That's healthy.
Right? Hey.
And I
have mixed it with bleach.
I'm awake now. They're keep smelling it.
Phil, at least you have to be thankful that this wasn't in Gerard's neck of the woods, because they would have
cracked you.
Open your mouth so I can give you this milk.
Yeah.
That's right.
Eat the milk.
They would have given you the milk.
Through the quick trade.
That's right.
So getting back on task here.
That quick trades, we just have skeletons.
The secondary EMT heads on out of the house, and they grab the stair chair and set up the stretcher to begin the process of extrication. While inside, she requests with the primary EMT that she wants to go to the local hospital that's 40 minutes away, that local community hospital, right? So
Do we have EKG capability?
It's coming in the next 2 paragraphs, because the medic is now arriving on the scene. So
right.
while this secondary EMT is getting extrication, equipment and stuff, the ALS ambulance arrives on the scene. Yes.
Can she walk?
Yes. I mean, she physically can walk. Is it
a mile to the fucking rig?
Do we want her to walk?
Has she been walking around for the past 3 days, 4 days?
I couldn't tell you.
Can we get to the ambulance quicker than waiting for whatever he's getting, a fucking Reeve or whatever the hell he's getting?
But what happens if she's having the giant STEMI and then you make her walk 12 steps and she dies?
Fuck it. What are you gonna do?
And she gets a lot of electricity.
That's what you're gonna do.
Right?
Are her legs still
Because it was meant to happen. It was meant to happen.
What was that, Phil?
Are her legs still doing the whole exorcist thing?
No, they're straight out in front of her. She's sitting up in bed with her legs outstretched in front of her.
I thought you meant she was sitting in a chair and she's just holding her legs up.
No. She's in bed, under the covers, just laying there.
That would have been my first fucking question if I walked in.
What the fuck?
What's going on down here?
Where do you guys?
You got orgasms.
That's how it got there.
So we don't have to worry about her legs. There's no weird exorcism.
You're getting ready to compete against Phil.
All right.
Okay.
Let's see. So the medic and the EMT get out of their rig. They have a quick chat with the the BLS EMT that's out there, and that EMT tells them all of what they found until they left. They give the full report outside of the house. So medic grabs their cardiac monitor, walks into the house. They go right up to the patient. They start asking the pregnancy questions like, "Hey, are you pregnant?" No. Is there a chance of pregnancy? No. They don't ask for any type of hysterectomy or any type of pregnancy history, nothing like that. And then they also start, asking down the route again of do you have any abdominal, history, any surgeries? No. Any cardiac problems? No. Everything's a no. So medic connects her to the cardiac monitor, initial rhythm from the 4-lead EKG. shows sinus in the 90s. They run an immediate 12 lead. They find no ST elevations or depressions, just sinus rhythm. So at this point in time, the equipment for extrication is back in the house, and the EMTs help her, stand up, sit down, get her all, attached to the stair chair.
Collapses and dies. Oh,
right?
No.
Dies. I gotta get that soundtrack from the Croods. That'll be great. Where Nick Cage just goes, and they die. It'd be great. She's moved outside on the stair chair, placed on the stretcher, and then moved on into the rig. Once inside the ambulance, the paramedic steps in, asks her how severe her left upper quadrant abdominal pain is. And she goes, an 8 on 10. It's still very sharp. It's very constant. Plus my back hurts. About the same. And the medic then goes, well, I'm willing to give you fentanyl for pain. And she goes, oh, I don't want it. Yes, Gerard.
Does anybody ever ask her to describe what the pain feels like?
Sharp, stabbing, constant.
Sharp, stabby, no Terry, no nothing like that.
No Terry, no nothing. No diffuse pinpoint.
Okay. All right.
So medic says, hey, I'll give you some fentanyl for pain. She goes, well, I'd rather not. And proceeds to tell a story that says, my grandmother was given fentanyl in the hospital, and then, a couple hours later she died, so I just want to stay away from it.
Because she was 97 and in the hospital.
Probably.
Okay.
Right? So So the medic goes, with no further explanations or conversations with this lady, goes, all right, cool. You guys got this one? And steps out.
Wait, what?
And
wait, what just happened?
And
I was so enamored with the size of Phil's thermos, I could have sworn you just said the medic turfed it.
So
that's what I thought I heard too.
So for those that were staring at the girth of Phil's water bottle,
that was a two-hander. Look at that thing. God damn, that's sexy.
I did not stutter when I said the medic looks at the primary BLS EMT, says, yeah, you guys are good. She doesn't want fentanyl. You guys have a good transport, and steps out.
Hold on. That's when EMT goes, no, I'm not good.
No, that's not
true. You heard me say that.
Everything, and they say, "Oh no, I got this. I've been doing this for years."
Right?
People
exactly.
So there's something going on. You're not pale for no reason unless you're fucking Count Dracula who never goes outside.
And you wonder why we don't get any respect.
Mm.
There you go. I give you Exhibit A, Your Honor.
Let's pause for a second.
Yeah.
I think everybody in the room is not okay with the fact that the medic turfed this. So, is other than there's obviously something going on here. Do you guys have any, thoughts in your mind?
The fact that I don't know what's going on is all the more reason to stay. And yeah, I mean, I'm thinking it could be the unbelievable fucking super rare NSTEMI that, every fucking hospital stamps on somebody. But I mean, it very well could be. This could actually be the unicorn, or it could be something else. It could be something, with one of her organs, or some kind of fucking weird GI issue. I don't know.
If only we could test them in the field for troponins.
Em, what are you thinking?
I mean, I don't think I would take that as a BLS provider. Thinking as a BLS provider. But I don't think sitting, if we have a 40-minute transport, let's go.
That's just to the non-cardiac hospital.
Right. No, they have a PCI.
No, that's the hour and a half one.
That's the hour and 15 minutes. They are transporting to the local community, 40-minute away hospital that just does some stuff.
Maybe not then. Maybe not. I'd push that a little harder then.
Well, and that's it. So like we all kind of agree that this is, the place where the EMT's like, yo, no. Like something's going on. As Emily says in numerous episodes, patient advocacy here comes high on the priority list.
Are they able to transmit the EKG?
Yes.
So why not transmit it and get somebody on the phone and say, hey, I'm sending this to you. Can you get someone that actually knows what the fuck they're doing to come take a look at it?
Because they turfed it BLS already and said, peace,
and
bro.
Then I would find another agency on way, be like, you need to come in my rig.
I agree. I don't know if I'd sit there and fight with this paramedic. I mean,
obviously,
I think that's probably wasting time. Right. But I'm not giving up on that yet.
Now, is it one thing to sit there and get like, I'm kind of trying to go through the thought process, put myself in that medic's, mindset of like, why are they turfing it? Is it because this lady's had the pain for multiple days? And vital signs are fine.
Worse. It's not the same.
Right.
Undereducated. He's undereducated. He doesn't know what he's doing.
I mean, I can agree with all of that, right? The pain's changed. It's increasing. But, it's a chronic problem.
There were no ST elevations in the front. What about our old friend AVL?
Couldn't tell you. I didn't see it. All I know is 12 lead had no ST elevations or depressions.
Oh, okay.
So, yeah, it's...
Well, good for him.
Right?
Did anybody take a blood sugar?
Nope. No, we don't do blood sugars on this show. Just for Emily's sake.
They're totally normal. No, they're if they're not altered, why would you do a blood sugar? We're not thinking that far ahead.
Whatever. It's fine. So,
back to when Emily yelled at me for bringing a drunk to her without a blood sugar.
You're welcome. You never did it again.
I did not.
So
what? Never took the blood sugar again, or?
Yeah.
Anytime.
Even as an EMT, dude says, "You okay with this, right?" I'm like, literally, like, I already know me. The first words out of my mouth is, "You're kidding, right?"
You got someplace to be? Like you?
That's a stigma, though. That's a stigma, because ask all the EMTs that are like, "Oh, I can handle anything." Like, just because you can doesn't mean you should.
Agreed. Right. That's the big thing.
I'm
good.
Our patients deserve better.
Yeah.
This is outside your scope. You have a higher level of care with you, and this is not something you send down the chain, dude.
Right.
Unless you know 100% what's going on and that it's bullshit, then yeah.
Well, and that's it.
Like right now, she may be stable, and there may be nothing at this point in time, but 10 minutes down the road, when she decides to go, and now you're fucking ALS,
And all the more reason she's complaining of pain.
Right.
How about, okay, Granny got it fentanyl. They killed Granny with fentanyl. Okay, how about I try to kill you with morphine? Or maybe I try to kill you with some ketamine, or maybe I just try to kill you with some Toradol. I don't know.
Well,
let me try and take some of your pain away.
Discussion. There was no discussion about this. Right. There was, I'm going to give you fentanyl. No, I don't want it. Okay, goodbye.
So
there was no other theory on it.
So
her vital signs right now will support morphine.
Yeah.
So that is exactly what was in my thought process while I was getting all of this information, in that, there literally was like, the medic came in, I'm surprised if they even thought about giving narcotics for pain. Clearly they thought, hey, she probably could use some narcotics for pain management. And then when she's like, nope, sorry. There was no education. There was no conversation. There was no like, hey, what was the story with your grandma? Was she on hospice? Like, was that why they were giving her fentanyl? And then she just passed peacefully. I'm going to give you, micrograms to what they gave your grandma. Let's educate the population on this stuff, because there's a lot of people out there that are scared of what fentanyl is in the news. Everyone thinks that it's going to immediately kill them.
But also, educate them. Like, this is how I'm going to monitor you after. This is what I can do if you have negative side effects of this. Like, there's options.
Exactly.
So I'm sitting here thinking, Okay, so you don't want to do pain meds. Okay, fentanyl's all you got. You don't want to fucking use it. You don't want to even consider anything else. Okay, well, you have a patient with a systolic of 160, complaining of chest pain, 8 on 10. Okay, nothing showed up on your 12 lead that shows, one side of the heart. How about go ahead and follow your protocol? Here, have some aspirin. Hey,
Well,
let's
that's
do
the other thing.
let's do a trial shot of nitro maybe, and see if you get relief.
So it's really interesting that you brought that up, because I was just going through the chat here, and there was a couple interesting different things that were being talked about in the chat. In that there was discussions about it could be mix of cardiac and GI, were their bowel sounds taken. I'm not.
Bowel sounds.
Well, and then what that again.
He does, not me.
Doctors do, but the problem with bowel sounds is that bowel sounds,
20 minutes.
You need 15 to 20 minutes to listen to them.
20 minutes. It's 5 minutes in each quadrant.
Exactly. Yep. So, like, for them to, I hear a girl. You're not doing it properly. Yeah. So EMS is not going to be doing bowel sounds.
You might as well be doing orthostatics.
Oh, don't get me going. Do not get me going.
Another Blue Lion drops there was a BG done. It was 72. Any aspirin or nitro given? No, that was a joke.
Blood pressure 120 and 80, respirations of 18, heart rate of 80.
Right. BG is 72.
Yeah.
They do know Jesus is watching you when you write down 16 for respirations, right?
Oh no.
Watch me, bitch. Watch me.
But yeah, even there's even questions like, why wasn't aspirin nitro given, on just
very least,
could this be cardiac in nature? Right?
I've got nothing showing if there's any gross hemorrhage. I've got her complaining of things that sound like cardiac issue. Her skin is, kind of presenting like there's a perfusion issue. Hey, you know what? I've got aspirin here. Take some of that. And hey, oh, by the way, I've got systolic blood pressure to play with. Here, take some of this and let's see if it helps. If it does, great. If not, oh well. Bye, Phil.
Bye, Phil.
Bye, Phil.
Bye, Felicia.
It's all right. Send Justin.
Yeah, he's got it all. He's got that shit.
Yeah, he's super EMT. He's totally got it.
Yeah, he's got this.
So vital signs are taken again, and
by 30. So.
Blood pressure via the manual cuff. Because again, remember now, there's no paramedic, so the BLS crew took it. Right, this is going in BLS to the hospital. Mm-hmm. Blood pressure via the manual cuff, 136 over 74. Wow. Heart rate of 86, strong and regular via palp. Respiratory rate 22, still non-labored.
Oh man, leave the belt on.
I was gonna say if he starts undressing, like
he did. He took all the shit off, man.
Somewhat. You know what bothers me about the little cubicle that he does this in, and I know I'm gonna be awful, is the giant fucking camel toe door. Like it drives me fucking crazy. That's like it's so right there. And once you see it, you can't ever unsee it.
Thank you. I didn't even notice it until you pointed out. Now I can't stop looking at it.
You're welcome.
And he just walked through it.
You're welcome. Look at that. He's back.
We're
hey, it's the ghost.
Hey, it's the Felicia ghost.
Hold on.
Hail to the champion, baby.
We're not worthy.
Right? So
oh god, there it is.
I told you, man.
We're good. The other crew's taking it.
Perfect.
Sure.
All right.
Great.
So
it looks serious.
So
you want to hang your poster up on that door for me, please?
Hide the badge door.
Oh my Jesus Christmas.
You want that one?
Sure.
All right, so recapping vital signs because we're almost done here, guys. Vital sign for Phil who missed this. Vital signs are retaken. Blood pressure via manual cuff is 136/74. Heart rate of 86.
Was the blood pressure on the same arm as before?
Yes. Heart rate of 86, strong, regular via palpation. Respiratory rate of 22, still non-labored. SpO2 of 98% on the good old room air. Still complaining of 8 on 10 sharp constant pain to the left upper quadrant, just underneath that rib cage. So during transport, she starts complaining of some nausea and tells EMS that she feels as though she needs to vomit.
Wait, she complained of nausea before and said she had vomited. How was all freaking before? What the fuck?
That was a couple days ago that she vomited.
But she was still playing nausea at the house.
Correct. With no right. She
another reason to stay.
You know what we can do? Fix that.
We are finding reasons to throw this medic under the bus. I 100% agree.
Yeah, fuck them.
Fuck them. Right? I agree.
The champ says, fuck them.
Fuck them. we'll just...
You suck. Yeah.
So, let's finish this up because we're running a little long. So she becomes nauseous. All right, tells EMS that she feels the need to vomit. And woohoo, what the fuck?
She's vomiting. That's probably what I would say too.
Sorry,
woohoo,
I totally fucked up my own computer screen for a second there. They grab her a vomit bag, and about 5 to 8 minutes later, she vomits a red blackish emesis. The EMT, though, is unsure whether it's actually coffee ground within the bag. Okay.
Dude, unless she ate fucking like spaghetti sauce an hour ago, it's red.
Agreed.
Bad things.
Agreed. So after this time of vomiting, she now begins to burp over and over. This causes abdominal pain to increase.
Is this a gallbladder
from
thing?
8 to like above 10. She also notes that her pain is no longer just in the left upper quadrant, but it feels as though it's moving across both top quadrants.
Is this a gallbladder?
Interesting thought process. We also have ulcers being popped in on the chat. And she also goes on to say that the pain between her shoulder blades is still present, but it's slightly more severe than before. So, you guys are already kind of thinking about changes. Is there worrisome things that are developing? You guys are about 10 minutes away from the hospital at this point in time. You got a BLS crew. The medic abandoned them.
I'm gonna make damn sure everyone on the radio hears when I call that fucking hospital. That's right. We're coming in BLS because our medic decided he didn't want to take this call.
Right.
We'll be there in 5.
Yes. Yes.
Oh, it's coming out, baby. I ain't gonna fucking hold back. Hell no.
Yeah. I'm 100% with you. Right?
I just
want to read
stuff like that. I'm gonna put your nuts right in a vice and squeeze.
I want to re-ask the question. There's no history of anything, no surgeries, no anything.
None.
Okay.
When's the last time she went to
a doctor?
Couldn't tell you. Couldn't tell you. So, M, you're sitting there again with your thinking face on. What's the thought process?
I mean, as a BLS provider, I'm going to take the facts for what they are. Like, her blood pressure went from 160 on 100-ish to 130 on 80. Her heart went from 80 to 90. She's vomiting blood.
Yeah.
Shocking.
I don't like it. Yeah, I don't like it.
We're trending downwards.
Right.
So, yeah, I mean, in your BLS, so all you can do is treat something. You can just treat symptoms.
Right.
She went from
All I can do is
compensated
treat
to
symptoms.
decompensating now.
Yeah, your diagnostic tool is basically your.
She was nauseous.
They call them your Mark 1 eyeballs. So, yeah.
Yeah.
That's it.
I'm going to take it for what it's worth.
Agreed. So, ultimately, this crew arrives at the ER. They don't see any, significant changes. She remains how she is after the vomiting. All right. They give her over to the staff. And I do have an update, a pretty significant update for you guys. But before I give an update, is there any overall arching, things that you want to talk about with how this call went start to finish?
The fact that she hasn't eaten or drank anything appreciably in a few days, I was thinking about this earlier, and I didn't really get around to it. But maybe a little bit of fluid would have been nice too. I know it's not necessarily for blood pressure, but to kind of rehydrate the poor lady.
Yeah.
Maybe a little something.
She's been nauseous. She's been vomiting, right? She has that loose diarrhea type stool. She's probably dehydrated, right? There's another reason as to why the paramedic probably should have stuck around, or at least the EMTs be like, yo, what the deuces?
Yeah. I know your PlayStation's waiting for you, but, work. Just saying.
Yeah, there's a lot of things like, advocate for your patients. This patient needs a lot of things that should have been done, the cardiac route, some fluids, some Zofran.
There's a bunch that could have been done for this lady.
Different pain meds, even trial nitro, whatever.
Right. Even if they're like, sometimes we have to understand that we are going to bring people in and have absolutely no fucking clue what we're dealing with. And that's okay. Like, we don't need to be right. Like, we don't need to know what we're dealing with all the time. Sometimes we
have to have a working understanding of what the processes are in the human body to figure things out a little bit,
Exactly.
I may not have a definitive diagnosis. I can say, hey, okay, based on the signs and symptoms and what she's told me about the past few days, okay, I can give her some fluids. I can do this. I can do that because this is within my protocol. This is what they tell me to do. I don't have to sit there
and that's the thing too, like, why aren't we treating symptoms? Like, this woman feels like shit. She looks like shit. Why aren't we making her feel better? I don't know what's going on, but I can make you feel better.
Oh, Granny died from fentanyl. Great, I have morphine.
Right.
I have so many other options. Or, hey, like, I understand that was a really tragic event for you, but, like, this is how I'm going to monitor you, and this is what I can do if you get too much.
Yeah.
Like, if you feel like it's too much, I can do this.
Right.
Yeah, I have these tools for monitoring. I can blood pressure.
Right. This is what I'm going to watch.
I can give you 25.
I could put a thing in your nose to monitor your end tidal to make sure you're not under breathing or over breathing. I can fix those things.
Right.
I have other medicine that can counteract it in case you get too much. You can take care of all these things.
A little bit of conversation would have went a long way, and a little bit of caring and investigating from the medic and thinking like I think there was a rush to judgment of like, oh, this is chronic. She's just whatever. Like, her vital signs are fine. She's pale, but she's not crying. So, yep, I'm going to throw up. You don't want some morphine? You don't want some fentanyl? Fine, whatever. Exactly. I'm done. They can handle this.
Even if it is chronic, you still have to treat the patient for what the patient.
Right. Agreed.
And that's the thing. And I say that all the time to people. They're like, oh, they have these chronic illnesses, but that doesn't mean they don't have acute exacerbations.
Bingo.
You can still treat these things.
Right.
Or hey, some poor fucker has cancer. Okay.
Yeah, that's chronic. Are you not going to treat
their pain?
Right.
That's so cruel. So cruel.
100%. So the update that I have for you guys is kind of wild in that it opens up a whole door of conversation with this patient.
Stubbed her toe, that was it.
What was that?
No. She stubbed her toe, and that was all that was wrong with her.
UTI. There you go. So the hospital goes and evaluates her, and initially believes that she's got a case of gastritis, and that's what's causing this pain.
That wouldn't explain the stuff coming up.
Agreed. So remember, gastritis is inflammation of the lining of the stomach, right? The stomach wall itself.
Right.
So they think, okay, well, this would explain the pain. It would explain some of those other types of symptoms, but it wouldn't explain the, GI bleed type, symptoms.
You know what
there.
else it wouldn't explain? Why her
Diaphoresis?
fucking skin went to pale. And the diaphoresis, correct.
Yep. Well, she was never diaphoretic. She was just pale.
I'm sorry, pale. My
Right.
bad.
So,
And she's not emo, so.
but even still,
My
it
bad.
doesn't explain why she's pale either. Correct.
Right.
So they put together a blood panel, and it comes back with a significantly high white blood cell count. So they go and investigate a little bit deeper, and they find through a lot more thorough history taking that she had recently come back from living 6 months abroad with her church group.
Oh, boy.
She only returned a few weeks ago, and this week she was staying with her mother just to visit because she hasn't seen her in 6 months. Gerard, why are you like, Turk's going to drop the ball and I'm going to hate myself for it? What?
Go ahead.
What?
Go ahead.
Malaria.
No, go.
Malaria. That's a good
Malaria.
one, right?
That's what I was going with.
Due to
The
this
feverish feeling,
due to this
changing skin color.
right? Due to this new information, the doctors test a little deeper, and they find that she's contracted H. pylori.
Oh,
Oh.
Justin should have been here.
Right?
That is not as exciting as I was hoping for.
Nope.
Yeah, no.
No,
I was
it
gonna say
isn't.
Justin should have been here because that's his shit, man.
That is
No pun intended. He fucking. Like just say those words to him. If he gets back while we're still on, just say, "Hey, Justin, tell me about H. pylori," and then just sit down, crack open a good book, get your pipe going, and just get ready to
listen. Absorb the.
You'll be there for a while.
Exactly. Right. So
Yeah.
she's ultimately going to be.
It's like some other medic we know with rhabdo.
Rhabdo. So
You know what I'm talking about.
she's ultimately going to be treated with multiple different types of antibiotics, and eventually makes it home. So I thought that this one was really interesting because, like, there's a lot of people out there that have never heard of H. pylori.
And like I said, I only heard of it from him, and I only know some of the signs and symptoms. I really don't understand it completely.
Well, and that's why I thought this one was really good, because once I deep dived into it, I found out a bunch of stuff that even I was unaware of. So,
but even when you think about H. pylori and you think about it in pre-hospital medicine, you treat the symptoms. There's nothing that you can do as a pre-hospital provider that's going to fix H. pylori.
Correct. Exactly. Right.
So
You
all
still
we can
treat
do
the
is
symptoms.
fluid management and treat
Pain.
treat with Zofran. Pain management, like you treat the symptoms, and we failed at that on this call.
100%.
We didn't do shit.
We didn't do shit for it. Right.
The only one who shit was the patient. Yep.
Agreed. So, I'm going to probably butcher this because I that's what I do. H. pylori is short for Helicobacter? Helicobacter? Okay, that's what I was gonna say. Helicobacter pylori bacteria.
Goddamn Germans got nothing to do with it.
A majority of patients with H. pylori never get sick or show symptoms. However, those that do actually show symptoms, those symptoms will mimic gastritis or ulcers. So you get abdominal pain, you get nausea, vomiting, including the coffee ground emesis, loss of appetite, you get burping and diarrhea, you get bloating and weight gain, you could get black tarry stools and other, symptoms of GI bleed, lower and upper. And what I thought was kind of crazy, and this just different, worsened abdominal pain on an empty stomach. So remember, she said she had soup the other day and her pain subsided. and then she didn't eat and her pain increased. Right? So that's something that's unique to H. pylori that doesn't happen in other things. So I was like, that's really interesting. Right? So ultimately, damage is done to the lining of the stomach and the initial part of the small intestine, aka the duodenum, right?
Duodenum, yeah.
The duodenum. This is something that half of this I never knew, which is kind of cool. We all learned something, right? If left untreated, H. pylori can turn into chronic gastritis. That I knew. What I didn't know is it also can cause stomach cancer.
Yeah.
No shit.
That I never knew. So I was like,
too much of a good thing is bad.
Right? H. pylori is highly, and this is why they were thinking about this when they got that backstory, right? So it really shows you how important questioning is. H. pylori is highly prevalent in third world countries with unclean food prep and water sources or poor cleanliness and sanitation standards. So if
it's funny.
Go ahead.
Yeah, no, I was just gonna say it's funny, you bring that up because I was just listening to something the other day, and dude was talking about, and he kind of reminded me of something. He's like, how fortunate we are. He says, and it's something I never really thought about. I mean, it's something you think about at the time, but not on a day-to-day basis. If you've been overseas and you've been to other countries, and like how fortunate we are that you can literally at damn near almost any place in this country walk over to a faucet, fill a glass of water, and drink it.
Right.
And not get violently ill.
Right. Not be like, I'm going to die from this. Great.
Right. And this is and here's the shocker. Most of the rest of the world is not like that.
Agreed.
Yeah.
The majority of the world, you will become violently ill if you drink the water.
Yeah.
Yeah.
But isn't it like E. coli is the number one, so C. diff is naturally found in your body. Like if it gets too extreme, then you have an issue. E. coli is the second most toxic bacteria when it comes to like GI stuff, and H. pylori is the third.
Yeah.
Like those are the three ones that you think of when you're talking about like GI bugs or like those bacteria that are causing GI symptoms. It's C. diff, E. coli, H. pylori.
Yeah.
Yeah.
And the last thing that why it's so prevalent is H. pylori spreads so easy, right? Direct contact, person to person, saliva, stool, vomit, right?
But isn't part of that because it lives forever on like multiple different
it lives
surfaces.
It lives a long time, and this will make everyone want to go and like freaking like brush your teeth,
sanitize,
right? It lives in the plaque on your teeth.
Yeah.
So like if you kiss your significant other, or Phil has an oral moment with the vaginal door, you can spread H. pylori.
Wow.
Wild. Right? Poor Phil.
And it lasts forever.
And
they say like a bacteria that comes out in its unnatural environment will die soon, but H. pylori lives forever.
Yeah. So it's I thought like even though we don't ever hear about H. pylori, like it's not in your textbook, we don't learn about it in infectious disease and shit like that, or your abdominal GI chapters. I thought this one was like a good abdominal call for a lot of reasons, right? The cause, the symptoms, but also like the operations of it, So it kind of hit a bunch of talking points.
And it really kind of surprises me. So was this pre or during or post COVID?
This is post COVID.
So we should already be asking people, or at least be used to asking people, so you've been out of the country recently.
Yeah.
Especially with weird shit that's not ringing any bells.
Right.
I mean, like for this patient, they were out of the country, but H. pylori is still prevalent here.
Yeah,
that's true.
Like Turk said, like it's in the plaque of your teeth. I mean, that's one of the things when you send the cultures out for like GI stuff, that's one of the most common things that you test for, because it is prevalent here.
Yeah.
Yeah, I mean, that being said, I mean, it may have also been one of those things where, hey, I'm not getting my, nothing's ringing a bell here. This is all looking funky. I don't quite understand. Yeah, if I knew that, hey, maybe she just got back from a trip overseas. Now I may not know what it is, but I might go, maybe we should fucking like take some precautions and maybe, this might be something that needs to go someplace a little more than the community hospital.
But that brings it up too, is like, okay, so I truly have no idea what's going on. Like, I wouldn't have come up with H. pylori for that.
I wouldn't have.
I'm still treating symptoms though. Yeah, at the end of the day, if I have no fucking clue, if I have no clue what's going on, I'm still going to treat that pain, that nausea, and that fluid loss.
Yeah.
Right. And that's, again, that's a big thing of why I brought this up, because there was such a lack of doing that, that it was just like, yep, we're done. We're done here. Whatever. Cool.
And let me guess, he still has his job.
Of course.
Of course.
Well, of course, because the patient didn't have a negative outcome.
Right.
They still survive. And that's the thing, like, these patients, they're not going to die from not getting treated.
Right.
Not, in the 40 minutes it takes to get to the hospital, but I still could have made a difference in that.
Right.
Yeah, this goes back to that thing we talked about how we measure ourselves, and not just with our junk, but like actually, I know I'm bad, and there's courses that they just make you take for me.
Not on this show.
But I gotta stop doing this. I'm giving false advertising. Anyway, no, I mean, our metrics are, I got a code save, fucking intubation, fucking some other big shit, and it's like, okay, whoop-de-fucking-do. How often you do that? How often you get your code save? Okay, I ain't got one. Shit. But you know what? Yeah, how many times did you turf a call that you shouldn't have, motherfucker?
Right. Yeah. Call them out when they fuck up.
Yeah. How many times did you do that and you should have wrote that in? Why don't we keep track of that?
Right.
Yeah, you and I talked
But they won't. They won't.
No. It'll show how terrible the industry is.
Yeah,
that's what it'll do.
You and I talked about that one night, G, about like how many times you took the diff breather in and treated the diff breather, how many times you walked it, done this, put on this call, that, you talked about that one night.
Yeah.
Yeah, because it was the one that you're doing. You did some call. I forget what the hell it was, and I was, or you were feeling down about something. I forget what the hell it was, and I was like, dude, just think about it, man. How many times how many people have you? I can count how many codes I've done, and I can count, how many intubations and all that stuff. I can, if I sat and figured it out, I can figure it out. I can't fucking count how many fucking people I've gotten where they're fucking dying, and by the time we get to the hospital, they're fucking with 120 over 80 blood pressure, and they're fucking waving to the doc.
Yeah.
I don't know how many of those there are. How many people out there are alive today because of me?
Right.
And my partner, or you, know,
but
or
that's what
anybody else.
kills me is everybody wants to gauge like, oh, well, I had this save and I had this reversal. And like, so how many, A, how many of them walked out of the hospital and had a successful life after? But B, that's not what I want to do.
No, it's 100% the fact, right? We look at the hero metrics,
right?
Because and it's so skewed. I'm gonna end it here, but like you think about it, like it's so skewed because we sit there and we go, oh well, great, I had 3 intubations this month. Okay, great. What's your success rate? 64%. But I had 3 intubations on the 3rd try each.
Guess what? You had 3 intubations and they were all successful, 100%. Whoop-de-fucking-do. Great.
Right.
How many people did you fucking get who were COPD exacerbations or CHF flash pulmonary edema, and you fucking got there in time and you fucking got into the hospital, and then they were fucking satting 98% on room air when you walked through the door?
Right.
How many of those did you do?
Right.
Because that's what actually fucking matters.
Nobody thinks about that though. They will come in and they'll drop a patient off. They tell me, oh, they were 56% on room air and now they're here. They're joking with us like all is great. I'm like, wow, guys, you did a great job. They go out. They don't think about it again because that doesn't mean anything to them.
Right.
They don't care about that.
Right.
Oh, it doesn't mean anything to the young guys that are just got their card, but to the guys that have been doing this for 20 plus years. You know what I mean? those are the ones that were like, holy shit, I actually did something for that patient, you know?
Well, even for me, I mean, I've been
Yeah.
doing it 20 fucking years, but I got over that whole, big fucking, play moment type of fucking mentality to just, hey, you know what, this was kind of cool. Like I always think about one of the last ones I did there, where y'all, first got the push dose nitro, and I was the first one to use it, and that dude, man, he was fucking dying. He was dead man walking. That motherfucker was dead. He just didn't lay down yet. And if he did, he definitely would have flashed even worse. So, yeah, and like we wheeled him through the door, and he was sitting up talking, had his little cannula going, everything was great. And, yeah, he was doing all right. So, yeah,
Yep,
that one always sticks out in my head. It's like, because that dude should have been dead, but me and your husband did something about it.
Yeah.
In fact, that was when I yelled on the highway and told him, hey, pull the fuck over, get back here, and help me throw this motherfucker on the bench. Because he kept sliding down the cot and cutting his airway off. And I'm like, fuck this. Yeah, boom. Strapped him in. Hold that. Hey, how does that feel? Much better. Good, let's go.
That's awesome. All right, guys. Stick with us here. We're gonna go to end of tour here in like 5 or 6 minutes. But thank you again for joining us on the podcast end of things. We will see you later on in the month. I forget. Let's see. What is the date of the next little thingamajig we do here? Oh, it'll be the 16th. Oh my God. We're gonna do the first time ever. We're gonna do 3 podcasts in the month of June. And
we have to do some Patreons.
And we gotta do some Patreons. But the Phil Foundation, the champ, is working on the next couple Patreon episodes. So till next time, guys, thank you very much. Again, get your fucking cronuts.
Get your cronuts.
Get your damn fucking cronuts. Get your merch, right? And
the cronut is right here.
What?
The maker of the cronut is fixing her hair.
There you go.
Miss Cronut.
Miss Cronut. Love it. Absolutely. All right, guys. Till next time, stay safe. Take care. We'll see you next time.
All right. Hey, you can...
Thank you for listening to today's episode. If you want more information on the podcast or to send us a call review, please visit medicmaterials.com/podcast. To learn more about earning continuing education credit from listening to this episode or others, check out Medic Materials CMEacademy.thinkific.com. We appreciate your continued dedication towards EMS education and helping us advance the field. See you next time.